everyone. Let's look at some muscle anatomy. Keep in mind that I would like us to know the functions and the origins and insertions of these things as well. But let's start off here with some head, face, and neck muscles that I'd like us to know. First of all, looking at the front here, we can see this orbicularis oculi right here, circular muscle around our eye. We can also see this circular muscle here around our mouth, which is the orbicularis oris. We can see from the side here, this large muscle right here, one of the prime movers of mastication. We've got our masseter. Under here, we can see the buccinator, but it can also be seen easier from this side. If we remove the masseter, we can see this muscle running lengthwise underneath the masseter. That would be the buccinator. While we're over here, we can see this muscle right here in this temporal region, the temporalis, and that one inserts into the mandible as well, can help elevate the jaw. And then for the neck muscles, we can see this beautiful muscle right here, originating at the mastoid process and inserting into the sternum and clavicle. We've got our sternocleidomastoid muscle. All right, everyone, let's look at some torso muscles next. We can see I got our torso model here, one with that front torso region removed. First up, let's jump over here. This muscle that we can see sitting right underneath the lungs is called the diaphragm, and it is the prime mover of inspiration, or pulling air into our lungs. It can be seen here. It's easy to remove. And when we're looking at this thing, you can typically just see this little edge right here if it's fully placed in with all the other muscles there. Now let's jump over to our full muscular model right here. First up, keep in mind that on the muscle model's right side, we have the superficial muscles. And then on the left side, we've got our deep muscles with a lot of those superficial muscles removed. So we can see in the pectoralis region right here, we can see this big muscle right here. This is our pectoralis major, or the large muscle in our pectoral region. It's got two heads to it, a clavicular head and then a sternal head, but both of these in this whole area right here, they insert into the humerus and allow for shoulder flexion. Just underneath this pectoralis muscle, we can see, let me move it so I can hopefully get some light in here. We can see these muscles right here, which are these sharp edge, almost like a serrated knife right here. And these are going to be our serratus anterior muscles. And if we move over here, we can see where these muscles originate from. And we can see now a better representation of those serratus anterior muscles. We've got abdominal muscles. Let's check these ones out next. Keep in mind that on the anterior surface, we have this massive linea alba and then this huge connective sheath over many of these muscles. And these muscles are kind of all layered on top of one another. So let's start from the outside. We can see our external abdominal obliques right here. We've got this huge connective sheath. We can see our rectus abdomini, or our rectus abdominis muscle, straight down the center. And again, if we were to remove that external abdominal oblique, we would see this muscle right here, the internal abdominal oblique. So how can you tell these muscles apart? Well, they kind of all sit on top of each other, where the external abdominal obliques and this massive connective tissue sheath is most superficial. Then we've got our rectus abdomini, and then we've got our more deep internal abdominal oblique right there. The other way you can tell is the direction of the fibers. So our external abdominal obliques, they run down and in, or like it'd be where you would put your fingers into your pockets. So if you put your fingers into like a pocket of your coat right now, your fingers would run just parallel to those external abdominal obliques. Whereas the internal abdominal obliques, these ones run down and out. So So if you put your fingers in your pockets, they would run perpendicular to those ones. The last major abdominal muscles that cannot be seen here are going to be our transverse abdominals. And if we remove that whole abdominal and thoracic wall right there, we would see these muscles are most deep and they run straight across the body, and transverse means across. There are our transverse abdominals. Okay, looking from the back here, let's check out some of these muscles that we can see of the upper back. The biggest ones and the ones that I would really love us to know, first one, we have this trapezoid-shaped muscle right here, and we have one on the left and one on the right side. And this muscle right here is the trapezius, or the trapezium. And just underneath that, this large muscle right here, it wraps from our back, and it wraps around, and it inserts into our humerus. It can kind of help pull the arm back and down. That muscle right there is the latissimus dorsi. So you've got the trapezium up here, trapezoid-shaped, and on the back and lateral side is the latissimus dorsi. The other muscles that we can easily see from this view, we're going to talk about the deltoid muscle, this big shoulder muscle right here. All of these heads are all part of one muscle, the deltoid muscle, and we can easily see that sternocleidomastoid from here as well. Okay, let's continue to look at these arm muscles right here. We just covered the rotator cuff. The one that's typically mischaracterized as being part of the rotator cuff is this muscle right here, which is the teres major. Not part of the rotator cuff, but there's the teres major. Then we have several muscles in our upper arm or our brachial region right here. It helps to know if we're looking at the anterior or posterior side. So orient yourself with the hand and go from the inside. Here are the anterior surface of the antebrachial or the forearm, and it slides right up into this anterior brachial region right here. So the muscles of this anterior brachial region, we've got our biceps brachii right here, most superficial of the brachial region, and then just underneath that, we'd see this brachialis muscle right here. Both of these are in the brachial region, and they're named for the region that they're in. The superficial one is the biceps brachii, and it has two heads on it, hence we call it that biceps brachii, and the brachialis running just underneath that. On the posterior side, we can see this massive muscle right here. It is these two heads and then a third head underneath. We've got our triceps brachii. Triceps meaning it has three major heads in this brachial region. Running around the elbow is this muscle right here, which is the brachioradialis. It comes from the brachial region and it inserts into the radial bone, the brachioradialis. More muscles of the forearm. We can see this muscle right here. This is the pronator teres. Pronator teres can be seen right there. If we remove this muscle, now we can see this muscle right here, which is the supinator. So the pronator teres for pronation, the supinator for supination, or rotating your forearm side to side. Other muscles that we should know about here, let me reinsert this brachioradialis. We have one forearm muscle that I'd like us to know, and it is this one right here, this palmaris longus, which functions in squeezing your hand and a little bit of wrist flexion. How do you know which one of these is which? If you look at this flexor retinaculum right here, this connective tissue that's wrapped around the carpal region, the central tendon right here is the one that runs straight up into this head right here, or this muscle right here, which is that palmaris longus. So you go straight from the palm, and it's that central one that runs straight up there. Here, it looks like it's number 24. Okay, then the other generalities that I'd like us to know about is these anterior forearm muscles, they function in wrist flexion, whereas these posterior muscles back here, these ones function in wrist extension. All right, so here we have an arm, and we'll go over all of the arm muscles. But let's first start off with the muscles of the rotator cuff. So on the outside part of the shoulder, there's this big triangular muscle called the deltoid. Let's remove that because we want to see these rotator cuff muscles here. Okay, notice that we can see the acromion and spine of the scapula right here, and then we have muscles that sit above and below the spine. There are 4 muscles of the rotator cuffs, and you can remember them as sits, S-I-T-S, sits. And these muscles are the supraspinatus muscle right here above the spine, supraspinatus. This muscle right here, and it's sort of all of these fibers right here. We've got our infraspinatus below the spine. Right here, we've got our teres minor. If we flip and look at the anterior side, we can see this big fan-like muscle right here, and that is the subscapularis below the scapula. Again, these muscles are the supraspinatus, infraspinatus, teres minor, and then subscapularis, S-I-T-S. Okay, let's look at our leg muscles next. So we got a nice leg model right here. We'll start up at the proximal end and sort of work our way all the way around. You can see on the posterior side, we got this massive muscle in the gluteal region. That's going to be the gluteus maximus. And if we were to remove this gluteus maximus, we would see the gluteus medius right underneath that. And I have a model with the gluteus maximus removed, and there is that gluteus medius right there. Okay, let's first start off with the quad muscles. The muscles, let me see if I can hold you up and work with this. So if we stand the muscle up and we look at these muscles of the quad, we got a couple muscles in this area. First, let's do the 4 major quad muscles. So the muscle running straight up and down in this quad region, or this femoral region, we'd have our rectus femoris. And it's the muscle that runs straight up and down rectus in this femoral region. Then we would have a teardrop-shaped muscle on one side and a teardrop-shaped muscle on the other side. And these 2 muscles are really big muscles of the leg, and so we'd call them the vastus muscles. We've got a vastus muscle on the medial side of the knee. We can go from the big toe straight up the medial side. We've got our vastus medialis, and then the vastus muscle on the outside part of the knee, go from the pinky toe straight up to that lateral side. We'd have our vastus lateralis right there. If we were to take this rectus femoris muscle and remove it, we would see the last major quad muscle, the vastus intermedius, which can be seen right here underneath the rectus femoris. Those are our 4 major quad muscles. Keep in mind that this muscle right here is oftentimes conflated, or some people think that it's part of the quad muscles. They say it must be 1, 2, 3, and that's got to be the 4th one. The 4th one is the deep one underneath the rectus femoris. This muscle right here happens to be my favorite. It is the sartorius muscle that wraps from the outside of the hip to the inside of the knee right there, kind of moving on a diagonal. It's got a bunch of really cool functions. We'll talk about those later. Okay, we've got rectus femoris, vastus medialis, vastus lateralis. Underneath the rectus femoris, we'd have that vastus medialis. We've got our sartorius right here. We already talked about the gluteus maximus, just underneath that, the gluteus medius. So now let's move on to these hamstring muscles back here. Okay, looking from the back, we've got on the lateral side, this muscle right here, and then we've got 2 muscles stacked up right underneath these 2 on the medial side. This muscle right here, it's got 2 major heads. You can see one head right there, and the other head is up here. This one muscle with 2 heads is a bicep muscle, but it's in the femoral region. We would say it's the biceps femoris. We've got a biceps femoris right here, and you can see the other head back there. Then these 2 muscles, you might think, well, are these just 2 heads of the same muscle? They're not. We have 2 muscles that are stacked up on top of one another right there. We've got our semitendinosus right there, and then underneath that we have our semimembranosus. How do I remember the difference between these two? If we were looking straight from the top here, the muscle that's on top is the semitendinosus, top with a T, and then the semimembranosus is underneath that. And those are the major muscles of the hamstring. Okay, let's do the inner thigh muscles. If we look at the inner thigh right here, we can see a few major muscles. The way I orient myself here is I find the most medial muscle, this really long muscle right here. That's going to be the gracilis. We've got our gracilis all the way at the inside, and then we have these two adductors on either side. There's an adductor longus and an adductor magnus, and then there's an adductor brevis, which is underneath that, that's not on our list to know. So we would have this big muscle back here is the adductor magnus, and it's easy to see from a posterior view. You can see that adductor magnus right there, the gracilis right next to it right here, and then this muscle right here, it looks a little bit longer than that adductor magnus. That would be the adductor longus. So again, gracilis, longus, adductor magnus. Adductor longus, adductor magnus. Okay, another muscle that starts in the upper leg up here. We've got this muscle right here that attaches to this long tendon right here. We've got the tensor fascia lata. I've heard it pronounced a couple different ways. I think probably the best way to say it is the tensor fascia lata. And that connects right to this long band right here, which is the iliotibial tract, or the IT band right here. Iliotibial tract to the IT band. Next, moving into our distal leg, we can see this big muscle that's on the anterior side, right next to the tibial bone right there. This is our tibialis anterior, the tibialis anterior right there. Flipping it over, we can see our calf muscles, and we've got these two huge heads of one muscle here, which is the gastrocnemius or the gastrocnemius. It has a C in it. You can pronounce the C or not, the gastrocnemius or the gastrocnemius right here. Two major heads, just part of one muscle, and then underneath that gastrocnemius is the soleus. And you can see the soleus muscle on either side. How do you know which of these is the soleus and which isn't? The soleus merges with this big tendon that connects to the gastrocnemius, and this is the calcaneal tendon that meets up with that calcaneal bone right there. Both the gastrocnemius and the soleus merge into this calcaneal tendon, and the other ones do not. They're in part of the medial or anterior chamber there. Any ones that we're missing around the leg here? I think we got them all. The only other one that I wanted to show us, it's a little bit difficult to find, so let's go back to our musculature model right here. On the deep and inside part of our pelvic bone, you can see that iliac crest right there. We can see this muscle right here that goes from our vertebral column, and it inserts into our femur and it undergoes hip flexion. And this muscle right here is the psoas major. You can see the psoas major there, and there's a psoas major over on this side right here. Okay, looking at our full body muscle model right here, we got a couple more torso muscles that I'd like us to check out. If we zoom in right here on this thoracic cage, we'll notice that there are some deep muscles and some superficial muscles that run in between the ribs here. These deep ones are our internal intercostals, and then these superficial ones right here are our external intercostals.